YouTube channel. If you're coming on here for the first time, thank you so much for clicking on this video. And if this is your second time or your third time or your fourth time or your fifth time on this channel, thank you for the continuous support. I'm super excited today. Today we're going to be talking about something that is really interesting, and I'm going to do my best to make it as fun and as interactive. Okay, maybe not interactive because you're not here, but like you get relatable. That's the word. As fun and as relatable as possible. So without further ado, let's get into the video. So today we're going to be talking about common misconceptions about the female reproductive system. Okay, what I mean by misconceptions are like this kind of thing that you just keep passing from one person to the other. Maybe Nena's grandmother told her mother, then her mother told Nena, Nena will now tell her daughters will now tell their friends, and just things will just keep going and going and going and going around, or something will just start trending out of the blue. So we're going to be talking about whether they are right or whether they are wrong. Basically, myths about women health. So let's just get into the video. But before we do that, I need you to stop right now. Hit the subscribe button. It's somewhere below on this video. Hit the subscribe button, turn on the notification bells so you can tell when I post new videos, okay? And then like this video, leave a comment below. If you have any questions, please just type them below and tell me what you think about this video. If you also have other video ideas you want me to talk about concerning health, please just let me know down below. Okay, so the first thing we're talking about is toilet infections. Well, it's a very common thing, even in the consulting room. People just walk in and they tell you, okay, doc, I've been having toilet infection, and I'm like, actually. First of all, there is no such thing as toilet infection, okay? The correct term is this: it's either a UTI, a urinary tract infection, or a vulvo-vaginal infection. That is what it is. There is no such thing as a toilet infection. A urinary tract infection, that is the part where urine comes out, where it's connected to your kidney, then your bladder, then your urethra, then out. Or the part of your system that is connected to your reproductive tract, that's in the female, since we're talking about women, the female, it will include the ovaries, the uterus, the cervix, the vagina, and out. So it is either an organism that is infecting your genital tract, which is what I just said, the uterus, the vagina, and cervix, and all that, or it is an organism that is infecting your urinary tract. And toilet infection, because people created that entity, I don't know who, but that entity is there, and then there's a certain thing to do. You just go, they'll give you antibiotics. Antibiotics is a group of drugs. Do you understand? There's no drug that's called antibiotics. So whether it's a UTI or a vulvo-vaginal infection, there are different antibiotics that are meant to treat them. You get, it's not I have toilet infection, I took antibiotics and all that. Maybe another day we'll talk about antibiotics abuse and the effects it has had on medicine as a whole. So there's no such thing as toilet infection. Moving on. So another thing people say is, it's good to use soap down there. Please and please and please. It's like bad thing have never happened to you before. Like you like to test the devil on a normal. It's something you like to do. Please do not use soap on that part of your body. When I mean down there, I mean your vulvo-vaginal area. Your vulva is the entire thing down there, that part that covers up the urethra and the vagina. So you don't use soap down there. You don't use warm water, or even if you use soap, you use mildly scented soaps. Mildly scented or no scented, unscented soaps. That's the only thing that you can use down there. And it's not as if you're using it to wash the vagina is self-cleansing. It cleans itself by itself. Do you understand? It doesn't need your own omo. So that's it. Then another thing I have down here is preconception care. It's not something that's common in this part of the world. Preconception means pre means before, conception means conception, that's getting pregnant. So in this part of the world, people just stay like, okay, maybe I can get pregnant now. But there are things you have to do to actually keep your body ready to get pregnant. And as a woman, you have to take folic acid. Once you're, maybe, I don't know, let me use a typical example, maybe you're married and you want to have a baby. So once that idea is in your head, you have to get folic acid. Folic acid is important for the development of your child's nervous system, basically the brain and the spinal cord. It is very, very, very important for babies that their mothers were not taking folic acid. They can come down with what we call neural tube defects. I'm going to put some pictures of what it looks like. So basically the child will not have, the brain will not be functioning well, or the child will have problems with the legs or any other part of the body, will not be able to move the body well, because the brain and the spinal cord controls movement and coordination. So basically there will be a defect, a neurological defect in that child. Some of them even come and they don't have a head. Yeah. So it's important for you to take folic acid even during pregnancy and before you get pregnant. It's very, very important. Then another thing you have to do is you have to shed some weight. If you are overweight or obese, you have to shed some weight. Your weight is important because being heavy makes you prone to certain comorbidities like hypertension or diabetes in pregnancy. And if not treated well, these things can actually cause death. People don't understand that pregnancy is a life-threatening condition. Yes, there are women that get pregnant and they never come out of it. The only mistake they made, in quotes, or the only thing they did wrong was that they got pregnant. Okay, so please, one of the things you can do to prevent some of these diseases is making sure that your weight is okay. Do you understand? That shawarma where you want chop, where they say no me they chop, na baby they chop. Anyway, then thirdly, another thing you have to do is if peradventure you already have some of these comorbidities, like some of us don't even check our blood pressure. Like hypertension to us is an old man's disease, cannot affect me. It's when I start turning 50 I'll now start checking. It's not true. You have to know whether you're hypertensive already. You have to check your blood glucose once in a while and find out your glycemic level. Know whether you're prone to diabetes or you have diabetes. So if peradventure you have any of these comorbidities, I'm using hypertension and diabetes as a baseline, as the first two, please make sure that you are registered in a licensed hospital with licensed doctors, licensed specialists if possible, cardiologists, endocrinologists, that are seeing to that you're getting your drugs adequately, and you on your own part, you're compliant to your medications. Part of the things that happen is that people get the drugs and they don't take it. They believe that once they take it and the thing goes down, it's okay. You have to do your own parts by making sure that you control these comorbidities. Then also you also have to stop smoking if you smoke, stop drinking if you drink. These are things that will help prevent any form of anomalies with your baby. Do you understand? And also you also have to ensure that you avoid taking certain drugs. Certain drugs can interfere with conception and all that, tweak your ovulation and all that. Like take for example NSAIDs, that's a non-steroidal anti-inflammatory drugs. An example is ibuprofen, diclofenac. So this is preconception care. Ensure you eat healthy, fruits, veggies. Just make sure that you're doing your possible best to maintain a healthy body that can accommodate a baby. Then another thing is antenatal care. Antenatal care is you're already pregnant. The issue is be coming to be checking on yourself and the baby. They say no, once I book nje kwanata ogwu, nje nchita ogwu, na awuzi ogwu, oge mruo nje muo. You are entering a ditch that is very deep. You get me? Please, as soon as you miss your period, carry your 2 legs to a good hospital. Because people just go to, or anybody that just answering doctor, you walk into the place and you sit down and you tell them that you want to look for a good hospital, please, and book for your pregnancy and have your regular antenatal visits. If you're going to a hospital that is not placing you on routine drugs, there's something wrong. Okay? If you're going to a hospital where they tell you they don't need to come again till 6 months and you booked at 2 months, there's something wrong. You're meant to have routine antenatal checkups. These are things that are directed by WHO, and they know what they are doing. There are certain tests you have to do at each stage of the pregnancy to know how your baby is doing. It's very important that you have routine antenatal checkups and you attend them wholeheartedly and you're compliant to whatever they tell you. Okay, there are a lot of women that have problems during delivery. They don't go for their checkups, don't know anything about the baby. When it's time to deliver, you come and sit down and you deliver, and then your baby is dead or your baby can't come out, and a lot of things, because a lot of things they check before you deliver. Do you understand? Okay, so the next thing I have here is fibroid. The common thing people always tell you that fibroid is cancer. It didn't even weak me to talk. Please, fibroid is not cancer. While fibroid might be an abnormal growth in the uterus, it is not cancerous. However, it can become cancerous, but fibroid is not cancerous. Okay, it's an abnormal growth in the uterus, and it usually happens in people that haven't had kids, what we call nulliparous women. That's people that haven't had kids, and people that have been continuously exposed to estrogen over a long time. That is people that are predisposed to fibroid. There are other predisposing factors to fibroid, okay, but it is not cancer. And is fibroid treatable? Yes, it is treatable. Usually fibroid is asymptomatic. Actually, it simply means that most people that have fibroid don't have symptoms about it. But when you start having symptoms, please present to the hospital, a good hospital where they can treat you and treat your fibroid. Okay, don't go and be taking herbal concoction, and you are drinking it. They say if you drink it, the fibroid, you pull out the fibroid. Hey, please do not take any herbal concussion to take away fibroid, or they'll tell you the fibroid will disappear. It's a lie. You're going to hurt yourself in the long run. Okay, so that is it for fibroid. Now, another one I want to drop. It's a very big bombshell. If I drop it now, people are going to shout. In my day in the live video, if you have not watched it, go and watch it. I made a comment there, which some of my friends corrected me, and I said, if you're going for normal delivery, we prep you. If you're going for CS, we prep you. And then they were like, CS is also normal delivery. So I want to, which leads me to this point, that is simply that CS is also a normal delivery. It doesn't make you less of a woman. It doesn't make you a non-Hebrew woman, because that's the common thing out here. Once people hear about CS, they see it as the end of the world. They see it as, they are less of a woman because they couldn't deliver children the way their mothers delivered, or I don't know, like people think a lot of things, and a lot of people have died because they feel like them doing CS is them not obeying, delivering their women's civic rights. I don't know what people think is wrong with CS, but CS is a normal way to give birth. Do you know the advantages of giving birth in CS? There are certain disease conditions that a woman might have, or certain anomalies, or certain things that might not favor you delivering vaginally. Do you understand? And you need that woman to do CS. So CS is not a bad thing. Please, if peradventure you're in a situation where your doctor recommends CS, please do your CS. Carry your baby. Be happy. Okay. Now, another one I have here is female genital mutilation prevents promiscuity. The circumcising girls. That's just what it means. Is wrong in every shade, every color, every concept, every idea. It is wrong. Okay, it's wrong to circumcise a girl for any reason whatsoever. It's wrong, and people do it because they feel like if they circumcise you, the person tends to less enjoy sex, and thereabout the person will not be promiscuous. But it's a lie. It's a very big lie. On the contrary, there are a lot of problems that come with female genital mutilation. They can even end up closing the entire tract, so the person doesn't have an opening to the outside. So please do not encourage female genital mutilation on any basis, on any ground. It is wrong. Okay? It's very important that women should enjoy their sex as well. Female genital mutilation does not have any advantage whatsoever. It only has a myriad of problems that follow it.